Well, with the triple therapy being approved now for COPD, there's an option that we can use triple therapy in more severe patients. The role of triple versus dual therapy is still controversial. Certainly when you look at the GOLD strategy, the recommendation suggests that the patients who continue to have symptoms despite being on one bronchodilator, two bronchodilators may work better. And in fact, some data show that they can have reduced exacerbation, improved symptoms, and decreased excess tolerance. However, data from studies like IMPACT, which looked at triple therapy in patients at high risk of exacerbation, suggests that using ICS, LABA, and LAMA, a triple therapy, may actually be more beneficial than LABA, LAMA, which are dual therapy, in reducing exacerbation and improving other outcomes. What IMPACT did not show us is which patient population would be most beneficial or may get best benefit from a dual versus triple therapy. They did look at blood eosinophils, and certainly patients with high blood eosinophils at baseline tend to have a better effect of triple therapy. So maybe that's a subgroup of patients with high risk of exacerbation would be the one most beneficial from triple therapy. Well, one of the limitations of studies looking at triple therapy is that they did not include homogeneous population. Certainly some of these studies included severe patients with COPD with high risk of exacerbation. Others included patients with moderate COPD who may be at risk of COPD exacerbation or not. In addition, not all these studies address the role of biomarkers in identifying people who would benefit the most from triple therapy. Certainly blood eosinophil has been looked at in most of these studies, but that may not be the only predictor of response. So I think we have to wait to see more studies, but also more the clinical experience with these drugs once they arrive in the market and are being used. I think definitely patients who are symptomatic, who despite one long-acting bronchodilator, they still have symptoms, deserve to have escalation of their therapy. The question whether using dual therapy, a LABA-LAMA, or a triple therapy, adding an inhaled steroid, is still of question. Definitely patients with severe disease, those with high blood eosinophils at baseline, recurrent exacerbation, certainly there are data now accumulating to show that triple therapy may be more beneficial in that population than just a LABA-LAMA. Patients who just have symptoms, no risk of exacerbation, may do very well with the LABA-LAMA without an inhaled steroid on board. Why? Because we try to avoid inhaled steroids if possible because of potential side effects. I think triple therapy in the coming years will be utilized more as accumulating data show its beneficial effect in subpopulation of COPD. Certainly having all three drugs in one inhaler is a plus. It may be enhanced compliance and adherence to therapy. That's a major problem in COPD. And I think in those patients who instead of using three devices, using one device, this would be definitely a beneficial, there is a beneficial role for them in that population. Well, nebulization is an important platform of delivery of drugs to the lung. This is especially true in patients who have problem using inhaler devices. No matter what inhaler device you look at, many patients don't master it. They don't use them correctly. But it is more a problem in patients with cognitive dysfunction, those with physical dysfunction. Dexterity makes a big role in identifying people who would respond to a nebulized platform. The biggest problem has been is that we didn't have many drugs that come in a nebulized platform in the past. But now we do, and there are more drugs to come. So I think in that population, using a nebulized medication would be beneficial.